Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Viatris, Genentech, and Vertex. Here's your host, Laura Bonnell.
Andrea and Alyson Hoffman are twins born with cystic fibrosis. Andrea is 30 seconds older than her sister. The women attend Ohio Northern University. The pair are very smart and overachievers, as you will soon hear. Also, I have a cold, so in the podcast you may hear that in my voice. Apologies. This is the twins' senior year of college. Andrea plans to attend law school after she graduates. She advocates at the state and federal level, and she sits on the Rare Disease Advisory Council in Ohio, something that Michigan has yet to pass. She will explain a lot more about herself, too. She received her second Bonnell Foundation Education Scholarship, and she will speak at our September 30th gala with her sister, Alyson, who also attends Ohio Northern. This is the first year that she received a scholarship from the Bonnell Foundation. Alyson has a triple major and a minor, which you will also hear about. Alyson says that she enjoys in-person sharing about CF rather than sharing it on social media. She does a lot of public speaking about how she handles her cystic fibrosis. You're going to be so inspired by these women, by their energy, and you will realize that they are going to change the world in many ways. Both talk about staying healthy during a pandemic and doing treatments at college. So let's get this conversation started. All right. Well, welcome both of you, Alyson and Andrea Hoffman. It's great to have you on the podcast. And congratulations to both of you because you both got the Bonnell Foundation Education Scholarship. You'll both be at Ohio University again in the fall. Is that right?
Yeah, Ohio Northern University.
And that is Andrea talking, and
yes,
her sister Alyson is there too. You're at school now, aren't you?
No, so we're on summer break currently, but yeah, and thank you so much for having us. We really appreciate it. Thank you again for giving us a scholarship. It'll really help within our next senior year. But yeah, we're currently at home on summer break. We're both doing internships this summer. I'm at the Ohio Insurance Agency in Columbus.
And then I am at Cardinal Health as a marketing intern. So it's been a fun summer. We'll head back about August 9th. We are both orientation leaders, so that'll be fun to welcome new students back into the fall and help with move-in and welcome weekend. So overall, really enjoying our summer. And when we're not at our internship, we're hanging out with family, going swimming, all of the typical summer tasks and things. So it's been a good summer so far.
And you know, you say all of the typical, but you two are not typical. You're extremely involved. You're very busy. You both advocate. You both fundraise. You lend your voices to the CF community anytime you're asked. As a matter of fact, Andrea, you did a webinar with us last year with Sierra Hicks.
Yep.
And you talked about and really answered so many questions to other people who were thinking about applying to the Bonnell Foundation Education Scholarship. And we really appreciate that. But if you wouldn't mind sharing your experience about, you know, how the process went, what you learned, and how this is your second year getting a scholarship from us, how it's helped from beginning to where you are now.
Yeah, for sure. The scholarship process was pretty seamless and easy. There were only a couple of things that I needed. So a letter of diagnosis from my doctor, an essay talking about my impact and hopes and involvement in the healthcare and CF community, school information, those types of regular things that you would need for a scholarship. But it was really easy to apply online. And it's been so helpful for my education, being able to have that scholarship, to then know I wouldn't need to work a little bit more in a job or apply to other potential scholarships that might be needed to cover the costs to go get a great education at Ohio Northern. It's been really, really helpful and beneficial. It's also through that webinar, I've been able to connect with other CF people around the country, which has been a lot of fun too. So definitely grateful for it. And it's really, really easy to apply. And I definitely recommend it to anyone thinking about it.
Your essays, both of your essays were really well written. They were beautiful. They talked about all the advocacy that you're doing. And that was this year's question. Explain, Andrea, we'll still stick with you in this answer. What kinds of things are you doing, at this time and come the fall?
I am actually serving on the Ohio Rare Disease Advisory Council. I was appointed by Governor DeWine and working with a number of different rare disease groups. Within that, I am the youngest on the council, as well as the youngest patient, obviously. But right now, we're really working to identify a variety of different groups within the rare disease community and working on access for those groups. And that's been a really, really great and awesome honor to be on the council, learn more about other rare diseases, and to represent cystic fibrosis, which is the most important. And so making sure that the diagnosis process and treatment process within the state of Ohio is good for those who are being just diagnosed or recently diagnosed, and making sure families are connected with the proper resources.
And congrats to Ohio, because Michigan has still not passed the Rare Disease Advisory Council. We're very hopeful that it will be passed in the fall, but it's still in the process right now. What have you found being involved in the council?
Yeah, one thing that has surprised me, and I think really helped to put in perspective what rare diseases actually mean, is the number of diseases that don't have names, or their diagnosis story has so many different moving parts and things that you would never think about when diagnosing a child with something. And so I'm very thankful that CF has certain processes in place to diagnose cystic fibrosis, and that it's on the newborn screening within the state. However, there's a lot of work to do even with CF to make sure that everyone's represented equally, and then those diagnoses are made properly. So it's been really interesting. We also have another CF doc serving on the RDAC as well. So we're able to come at it from both a patient and research and doc perspective, which has been really great to have us represented on that. But yeah, it's been really fun and fascinating. I'll continue to serve through a 2-year term. So that'll take me up into graduation of college. So,
well, congrats. That's wonderful. And Alyson, what does it mean for you to get the Bonnell Foundation Scholarship? This is the first year that you've got it. So congrats. We're happy to award it. What does it mean to you, and what kind of advocacy are you doing?
Yeah, it means a lot. It means that I don't necessarily have to think about the cost or the price of my senior year. I can go look for jobs in the healthcare industry and really try to make my impact lasting in that location. Andrew and I have advocated on the state and federal level since the age of 7. A time that sticks out in my head is we speak at first-year medical student classes at Ohio State, sharing our story. The doc is one of our longtime docs, and he teaches a class, so he shares kind of the genetic side and the diagnosis side beforehand, and we get to go in and chat about our story, chat where we are now. So really just those little touches of impact that we can make and help them to better understand and showcase what cystic fibrosis is and how to best treat patients and have that really good bedside care and help to those families and to those patients. We spoke at Vertex Pharmaceuticals to the marketing department and got to tour the facility, which is really cool. So just those little ways that we can help share our story and help reach out to make CF no longer stand for cystic fibrosis, but rather cure found. Everyone's story is completely different, and everyone in their moment of life is completely different. So helping to share our story and make that impact has been kind of our driving factors of what we want to do when we grow up. I'm a triple major in communications, public relations, and marketing at Ohio Northern. And really that was through my younger advocacy work days of, I like people. I like to talk to people. I like to share story and share information to others. So our advocacy work has definitely made an impact on our future careers. And with that scholarship, it'll help make an impact while we're in school and help us look for our future careers a little sooner than worrying about kind of where the money will come for senior year. So definitely appreciate it. And that's kind of how my advocacy work has played out.
So what exactly, Alyson, do you want your job to be? I mean, triple major, that's fantastic for anyone, and especially for somebody with CF, because you have the potential to get hospitalized, right? I mean, that's just a fact of CF. But what do you want to do when you graduate?
That is a great question. So kind of with my triple majors, definitely serving in some way of the healthcare industry capacity. I have an internship at Cardinal Health this summer that I'm really enjoying. I'm not going to be a doctor. I'm not going to be a nurse. I can't really do that type of deal. But how can I still advocate and still use my passion to help others? I definitely think it's somewhere in the healthcare industry, whether it's working for a hospital, working for Cardinal Health, which is a medical and pharma distribution company, or whether it's doing corporate comms for Vertex one day. Who knows? But definitely using those passions to help others. In my work at Ohio Northern and kind of on the now national level, I serve as the national president of the Public Relations Student Society of America. So I oversee about 7,000 members and 375 chapters within the United States and also in Latin America. And that's helped me connect with people and also realize, I really do want to do PR and comms and marketing and make that impact in that way for the healthcare industry and also the CF community. So that's kind of where it's led me thus far. I definitely like travel tourism, food and beverage, but I feel like I can make the biggest impact within the healthcare industry. So I'll stick there, and maybe as I get to my retirement, I'll work for McDonald's or something different, but definitely the healthcare industry and how I can use what I'm learning in the classroom to ultimately help others in different situations. So.
And I joke with you that you're so underachievers, because you're both doing so much. Andrea, kind of tell us what your goals are when you graduate, and then if you could both talk about, how CF. Has it been a roller coaster through the college years, or how has it been to have the disease while you're going through college?
My plans right now are kind of law school is what the next step is. Not exactly sure where. I start applying in September and October, looking at a number of schools in Ohio, Michigan State up in Michigan, and a couple of schools in New York and Virginia and Boston. So not exactly sure where, but my ultimate goal down the line is to teach. That probably will happen after I have some type of career. I don't know if that will be in lobbying, but my ultimate goal within law school is to study healthcare law in some capacity. So to be able to then work for a hospital or an organization and get the necessary things to individuals, more specifically in the social determinants of health. I really liked public health. That's one of my minors at Northern. And so being able to give people things that they need just to live a healthy life, but also looking at how their social determinants of health, of where they live, what access to things that they might have really impacts those basic fundamental needs and healthcare needs. But that's kind of the goal right now, is to get to law school somewhere. We'll figure that out. Hopefully by Christmas I'll have a location, and then take that for 3 years and really go what the next thing leads and something else that I like. Throughout college, that's kind of how my journey has taken me, is I've done things that I like and continued with that, and that's worked out well, and I've enjoyed that. But throughout college, I think that's something that when we were coming into college, we talked to a number of different older CF patients. Our parents talked to a number of college-age parents with CF, and to understand what does that process look like and how can we best set up ourselves to succeed throughout all of college. And first started at our Office of Disabilities at Ohio Northern. So coming up with a plan, if we were to be hospitalized for 2 weeks, what would that look like within our curriculum, and how would we be able to work through that? Thankfully, we have not been hospitalized at all during our college career, which has been such a blessing. And we've been really thankful because we know that's not the case for everyone. But really that open line of communication kind of started our dialogue. We've had some flare-ups of things where we've taken care of that with antibiotics, on campus regular oral antibiotics. but really making sure that our areas are clean and keeping everything clean has been really beneficial. We did go through college during a pandemic. And so when we were in person, we were locked down. We would go to class and really just hang out in our rooms with a small group. Really just me, Alyson, and her boyfriend of people. So that way we weren't being exposed to things. But that's been something too, going to a smaller school. We have about 3,000 on campus. A lot of individuals kind of realize that we have CF. We've done advocacy efforts on campus too, but really making sure that we're being communicative with our professors and those around us to make sure that they know expectations, but that also we're ultimately maintaining our health, which has been great. Alyson?
Yeah, Andrea brought up something that we've done through our time in college. Yes, we've stayed healthy, and we were actually roommates our freshman year. So we didn't have an outside roommate. We were able to control our environment, still share our closet of clothes and all of that. But throughout our time in college and our advocacy efforts, we're both members of the Public Relations Student Society of America. Like I mentioned, this year I serve as national president. But throughout our time, there has been a cystic fibrosis campaign and kind of a challenge to enhance awareness and advocacy on your college campus. And so it's through the Rowan University chapter, but we participated throughout each year, starting our freshman year. And actually, our freshman year, we won first place nationally for that advocacy effort, really just spreading awareness to our campus community. We partnered with the football teams at a fundraiser during the football game. And then our sophomore year, we partnered with the track team and talked about how running has helped with our lungs and just clear our airways. And then most recently, our junior year, we partnered with our Ada community and the Ada Elementary, and we talked about to their science classes about what CF is. They had a student go through their school a couple years ago with CF, and so they knew a little bit about it, but we wanted to share our story and kind of the impact. And so our first year, we won first place nationally. Our second year, we got third place. And we're still waiting to hear about what we placed our third year, but really not about the placement, but more of the advocacy efforts and the impact that we're making in our time at Northern. So that's been one unique opportunity that we've had to still advocate, but definitely sharing our story with our friends and really trying to, like Andrea said, keep our space clean and organized. During the pandemic, it was our our freshman year in the spring is when it hit in 2020. So we actually were headed home for a CF appointment on a Thursday, and our dad was like, I think we should pack a little bit more than just the weekend. And so we did, and actually by that Tuesday, Ohio Northern had everybody move out the following weekend, but we moved out that Tuesday just to be safe. And everybody was really flexible with our classes. And, it was a big unknown at that time. So everybody was just really confused and flexible. But we wore masks up until kind of the end of the spring semester, and Ohio Northern lifted their mask mandate in the middle of spring semester, but everybody understood that we kind of continue to wear our mask and keep our area clean and take those extra precautions that other folks don't have to necessarily think of before a pandemic or day to day. So that's kind of how we've navigated college. We're looking forward to our senior year and experiencing all of the lasts and the last homecoming and the last football game and all of that fun stuff, and still being active. So yeah, we've definitely been blessed with a clean bill of health while we were in college. Yeah, we had our moments of taking some antibiotics or leaving a little early from spring semester to have a surgery, but definitely has been a blessing for sure.
I wonder if you could kind of go back and share your diagnosis story. Did your parents know that they were carriers of the genetic disease, or did they find out after you were born? How did that story go?
Yeah. So we have to zoom back to December of 2000. We were both a typical twin pregnancy with our mom. We were born at 35 weeks and actually were really healthy for a twin pregnancy at 35 weeks. So I was 6 pounds, Alyson was 5 pounds, and we were doing pretty good. Then we started to develop a zinc rash and we weren't gaining weight. They would do everything that they really could. They cut nipples off of bottles. They were working with our pediatrician, but nothing was really sticking inside us. We weren't gaining weight. And so after a longer diagnosis process than that might take place today, we were diagnosed at 4 months old. Actually, a dermatologist came in and identified our zinc rash and said, have we thought about cystic fibrosis? And at the time, our pediatrician deliberately told our parents, you don't want it to be that. It's not CF. We don't want it to be that. And so sure enough, Alyson was first tested for CF and was diagnosed. And then they brought me back to the hospital and I was diagnosed with CF. And from that literal moment after diagnosis, we were moved up to the pulmonology floor. And a lot of our nurses and doctors that helped diagnose us and were right there at the beginning of our CF journey are still with us today, which has been helpful. But Ohio did not have CF on the newborn screening list. And so that helped to delay our diagnosis slightly based on the signs and symptoms that we were presenting. And so that's where our advocacy began, was really to make sure and ensure that CF was listed on that diagnosis screening. But no, our parents did not know that they were carriers beforehand. So after the fact, they figured that out with genetic testing. And then subsequently, all of our cousins and our parents' siblings have been tested as they start to begin their families and to make sure that they understand if they are carriers of CF before they have kids.
And Alyson, what do you think about having a twin sister with CF? Obviously, there's nothing you can do about it. And I ask that because both my daughters, Molly and Emily, who are 25 and 27, they have CF. They're not twins, but they prefer it. They say that it's easier because they know what the other one is going through. And I just wondered what the two of you thought about that.
Yeah, I definitely think it's great that we're both in it together and we both do have CF. We get competitive on our PFTs or on our weight gains, but it's healthy competition. It keeps us both accountable. And I think CF has really taught us amazing time management and what matters in life. So we're a good tag team. We're good at filling each other's pills, making sure we have this done, packing a vest, and taking it to go someplace. So it's a good tag team relationship. And I think it's taught us through our diversity, we can shine and do really amazing things. So definitely wouldn't want to do this life without Andrea. She's a great gal and really has taught me a lot of fun things just in life in general and about myself. But it's definitely good to have that support person who's in the thick of it and knowing. Folks with CF can't really be around each other as the risk of sharing infection is too great. But having someone in the flesh that understands and that can take those precautions with you and take those meds with you really helps. So yeah, she's been great. It's been fun just to be competitive of like, oh, let's go run. I'm faster than you or anything like that. And it keeps definitely both of us accountable to not only take care of our health, but to do really great things in the process.
Andrea, did you want to add anything to that?
Yeah, I think it's helped to understand our baseline too. So oftentimes, though within CF, you're looking at your own stats, one of us inevitably is a control factor in any situation. So if one of us is presenting symptoms and the other is not, we can then go back and see, okay, what were our exposures? What were we doing? Or if we both have the same something wrong with us or infection, we're able to see, okay, how quickly can these antibiotics work depending on whose body it's in and what's going on. So I think it's been really great. I wouldn't want to do this with anyone besides Alyson, even though sometimes, not all the time, she could get on my nerves, but that's the normal sister thing. But it's helped to have a little buddy to go through life with and go through tests and surgeries and things to really have that support. So I think we often talk about just our twin relationship being about a 21-year marriage, and it's really like that. So being able to be with someone and know how they work and anticipate things before they might need it, it's been a really great way to live life.
Do you remember when the first time was that you realized you had cystic fibrosis and what it meant? Alyson, if you want to start that off.
That's a good question. I think we've been asked this only a handful of times in our life. We don't remember. We really don't. It's been just kind of how we've lived. It's been normal. I'm sure our parents have had that conversation, right? Like they've had it with everybody in our lives, and with others. And we don't really remember it. We don't really remember them saying, well, other kids don't do this. Like, it's just kind of been a matter of fact and how it is. And we don't really view ourselves too different from other folks. Yeah, we get up a little earlier to take pills and do vest. And we really try to not watch what we eat, but try to eat everything and all that stuff. But it's never really kind of dawned on us that we're different, or that we had that like sit down moment of, you have cystic fibrosis, this is what it means. And in the back of our head, yes, we try to keep as healthy as we can. We don't know the amazing new drugs that are coming down the pipeline or what'll happen in 10, 20 years. But we've just tried to do our best and stay healthy and know that we really can control how healthy we are in our environment and keeping it clean. And our parents really set us up for success on that one. They were told when we were diagnosed to try to keep them as healthy as possible, because you never know what's coming. And that's kind of been our motto. And so, yeah, we really never had that moment of aha per se, but I'll let Andrea talk on this one too.
Yeah, like Alyson mentioned, I don't ever recall one singular moment that we knew. But I think what's been important for us is to be able to talk to parents that have never met someone with CF outside of their 1-year-old child, because they don't know what to say or what the child might know or what they're feeling. That's a main thing. If you have kids that can't speak or are too young to formulate how they're feeling, it can be hard as a parent to understand, okay, their stomach hurts and maybe that's because they haven't taken enough enzymes or they've taken too much, or what does a cough actually feel like and what's a better way to get that up. And so being able to really help parents identify what their child could be feeling if they've never met someone with CF, and really calm their fears. If you Google CF, it's a completely different reality than some of the reality that we're facing. Obviously, there isn't a cure yet, and there's other genetic makeups that might have it better, but identifying that really the goal is to keep them healthy as long as possible and as early as possible to ensure their health in the future. And so being able to help parents and calm some of their worries and help to give them a better reality of CF and of our lives really has helped us a lot.
And what do you think, as far as, you talk to other people in the community who have cystic fibrosis, what do you think your biggest, I don't know if challenges is the right word, but moving forward, maybe legislatively, what is the biggest challenge? And then as far as health, is it mental illness? Is it, stomach issues that need more research? What kinds of things do you think need to be addressed in both of those issues, in both of those areas?
Yeah, one thing that I'm really interested right now is the diagnosis process and what that looks like for different races and socioeconomic levels. That's one thing that we're talking about on the RDAC, but I think that's something that hasn't potentially been researched enough, and ways in which that diagnosis might go unnoticed until later. So really preserving that health as soon as possible is something that I found legislatively really interesting. And obviously ensuring maintaining access to state-funded programs for children to receive the healthcare that they need. That's something that we'll continue the fight with, and working on adults and making sure that they have access to things as well. Medically, I think really the next step in our life, and something that we've talked about with our peers and stuff with CF in the state, is understanding, okay, starting families potentially, what that looks like, when the best time would be for that. And something that we've experienced as we've gotten older too is a mental health factor. And that's something that's been definitely talked about in our clinic appointments and checked on. I think with the pandemic too, that's something that we've seen around the country, regardless of CF, is a rise in awareness for mental health and what that actually looks like. And so we've been fortunate to receive the proper resources that we need, but really those are kind of what we're looking towards to the next steps. But Alyson can talk probably more about that as well.
Yeah, I agree with everything Andrea said. I mean, we both see counselors more of life coaches and just kind of another listening ear. And our CF team has understood that and respected that. And it's a great resource. So, I mean, we 10 out of 10 recommend. I mean, it's never bad to, maybe you don't necessarily need the help, but it's always good to listen. And they're definitely part of our care team. And I think, yeah, I agree with everything that Andrea said. I don't know that I have too much to add, but just continuing the advocacy efforts and making sure everyone has great access to the care that they need, especially into the adulthood. CF used to be a childhood disease, and it's definitely amazing that everybody's growing up and getting old and having a great long life. So just continuing the efforts of what adult folks need as they get older, but continuing to support the kiddos that have CF as well.
And are either or both of you able to take the triple combination drug Trikafta?
Yeah, we're both on Trikafta, and that's been really helpful and beneficial to our health. One thing that we forgot to mention too on the next steps is really helping our docs work on that transition process. So we just successfully made it to the adult clinic based on our age. And so we have a number of other specialties that we see. I have arthritis as well. So that's another specialty, a number of different things. So working on what that process will look like and better help that process as our teens and young adults go into those adult stages of CF. And transfer over to those clinics. So that's something that we've definitely been working on and putting our input in as we've been going through the process and connecting those and working to better understand, but also connect to those doctors and individuals that know CF. And that's one of the big things that we've thought about is, okay, if we're going to someone for arthritis or someone from gynecology or someone from a variety of different fields, do they know CF and what that looks like? Especially now as individuals are getting healthier, but also have access to new medication.
And what does social media mean to you as far as learning about cystic fibrosis or sharing your knowledge about cystic fibrosis? Do you still think it has a big role to play, or how do you both see it?
That's a good question. Fun fact, I have a social media minor and do a lot of social media work for different organizations at ONU. But it never, I guess it never like occurs to me that, I know other folks have CF, but it never occurs to me that folks are sharing their story on Instagram until I'm scrolling through the feed and it's someone doing a vest treatment. I'm like, oh, that makes sense. Like it like clicks. Then we do a lot of, I guess, in-person advocating. And so sometimes those videos are like posted on social media. Like I'm thinking we did a presentation to the West Ohio conference for their annual conference. And that speech was then like posted to YouTube. We don't do too much like advocating or chatting about our story on social media. We just haven't gotten into that space, or I guess been eager to get into that space. But we do definitely support the different pages on social media. And normally we try to keep it a conversation in person. All of our friends and family know, like everybody on the family, friends on Facebook all know. And we share different updates of how our health is doing. But more so on the Facebook, where like family and friends are, not necessarily on our Instagrams. We view social media more as a professional platform. So we try to not keep it clean, but obviously keep it clean, but keep it more just kind of our interests and our, Andrew's laughing at me, but just our interests in that sense. So, but yes, we do follow all the different CF pages. We're on the CF Advocacy Facebook page and all of that fun stuff. But yeah.
And I wonder too, as I heard Alyson talking, and both of you, you're so positive. And I feel like that's almost a part of cystic fibrosis. It seems everyone I meet, my girls included, you know how important the small things are because of your disease. And I feel like there is so much positivity within the community. So I wanted to hear from you how that has been throughout your life. Of course, you have your down moments and you have the times when you're crying or mad, I'm sure. But overall, how have you kept up your work ethic, your school ethic, and the positivity over all these years.
Yeah, I think that's something that really are not, and our parents have instilled a lot in us, but that's one of them. And CF, I think really identifying things that we like to do from as small children. So we were in a number of sports, and that brought us joy. And really being able to use CF in a positive light to understand what are our interests in that and how can we help others. But yeah, it's definitely the little things. I mean, I'll pick up the phone and call someone, or even this summer, we do a lot of dinners with people just to connect from high school or just people around the Columbus area. And so it's definitely the little things because we value that so much. We've seen CF patients die or not be able to live their life to the fullest. And so really being able to have those mundane moments that make it truly so exciting, and being able to recognize that today in 2022, we're in a better position with CF than we were back in the 1980s per se. So really using our health to our advantage and maintaining that health because we know how it so easily could be stripped away from us just with one infection or something else going wrong. So Alyson can probably talk to this too.
Yeah, I think it's definitely just kind of our mindset. I mean, we talked earlier, we never remember having that sit down conversation of, oh, you're different from everybody else, or, oh, this is like you do this, but other people don't. So I think it's been that mindset of this is just the cards that we were dealt. This is how it is. And then also the amazing community of family and friends behind us. Our dad's United Methodist minister and our mom's a school teacher. So we have all of those school folks and church folks who are really behind us. And even the people that we meet in college, they've become our new family of support as well. So I think it's those folks that don't treat us differently, don't really look at us differently, and really know us for who we are and just the different things that we're passionate about, which I think has been helpful. I mean, you don't want people looking at you weird if you start to cough, or look at you weird if your stomach starts to hurt or you're not feeling good. So I definitely think it's those folks that have been behind us and been our community of support for the last 21 years that have helped us stay so positive and helped us not think of ourselves as too different. I mean, we are a little different and odd in some ways, but definitely for the CF side of things. So I think that's been our source of positivity.
That's wonderful. And anyone that wants to meet you in person, they can come to our event in September 30th. We're really excited to have the two of you coming with one or both of your parents, still to be determined, I'm sure. But that's exciting that you'll be able to come to Michigan and share your CF journey with us. Are you excited to come out this way?
Yeah.
Oh, yeah. I'm all about the outfit, so come for the outfit. We're still figuring it out, but definitely it'll be a great time. And I know we'll be with the Breath of Salt author as well. If you haven't read that book, start reading. It's a thick book.
It is, but so fast moving,
Yes.
right? It's so good. And we know the journey. We know the history of it. So when you're reading it, you're like, oh my gosh, I was there, or I remember this, right? It's
Right.
Oh, yeah.
Yeah, but we're really excited. I've only been to Michigan once, which is kind of odd. Alyson will go for her first time this summer on a little vacation. But I'm excited, though we're supposed to hate the state up north. We're excited to go and see and get to meet you in person, but also be able to talk more about our story and how much the scholarships have helped us and kind of our journey with CF. So.
yeah, there's a big rivalry between Michigan and Ohio, right? Everyone knows that. Tell us a little bit more about what your parents have instilled in you as far as just doing whatever you need to do to succeed in life.
I think that's really been the most crucial thing is them identifying that our health is more important than anything. And so going out or hanging out in high school, we would always have those times where okay, you have an hour treatment. So after the football game or after the soccer game, you probably shouldn't go out and get dinner with friends. So really prioritizing that health. And I think that's what's helped us in college so much. We already know that our health is our number one priority. And so maintaining that has then trickled down our decision making and what we do and when we do it. So I really think that's one thing that they've instilled in us that we're really, really grateful for and have got us this far. Alyson?
I would say just their public speaking abilities. I mean, Dad preaches every Sunday, Mom teaches throughout the school year. So definitely, I would say the public speaking and also the jokes. I mean, they've got good jokes as a lighthearted thing that they've passed down. But definitely their care for others. We see them help students in the classroom, but also help church members. So I think it's they passed a lot of good things down to us and instilled a lot of some strength and some positive attitude as well.
And that is wonderful, and I think so important as you deal with so many things related to cystic fibrosis. What are your hopes for the future for the CF community as we wrap up this podcast? Andrea, we'll start with you. What are you hoping for? You're both so young, and the future, things have changed so much in cystic fibrosis just since you were born. So what are you kind of looking forward to and maybe hoping to be a part of?
Yeah, I think for me personally, continuing with the RDAC and identifying ways in which we can learn more about CF and also support others within their rare disease journey, I think is important too. But really being able to see that legislative change in any capacity to benefit lives of CF and those individuals and their families, to then better increase access to care and things that they might need. I think ultimately the goal is for a cure, but even just to preserve health and life before that comes. Because I truly think within our lifetime, hopefully we'll at least see something. And so ensuring that those little ones are staying healthy and doing all that they can do for that day and that moment, but really, really working to identify some inequities within a variety of systems to ensure that everyone has access to the proper health care is kind of my next step. But yeah, Alyson?
Yeah, I would echo everything that Andrea said. And just to keep the positivity up within the community, I think especially with the pandemic, everybody's more on edge of making sure things are clean, and that's important, and making sure everybody's healthy, but just continuing to enjoy life. And hopefully one day CF won't stand for cystic fibrosis, but rather cure found, and we can write in the history books and document that moment in time. So thank you so much for having us on the podcast. We really appreciate it and very excited for that gala in September.
So are we. Thank you. Yeah, it's great to have you both on. And we will put contact information in show notes if people want to get a hold of you, and maybe high school kids might want some advice from you about making it through college with CF and treatments, and really setting time aside for that. I mean, I would think that is one of the biggest challenges. You just want to have fun when you're away from home and have fun, throughout your college years. But you have to have CF discipline as well.
For sure.
Yeah, that's the big thing. That and sleep. We've learned that the 8 hours are very important at night for us to get. But yeah, we appreciate coming on here, and we'll get you all that info. So if anyone has any questions, most definitely happy to help.
Well, thank you both. We appreciate it.
Thank you.
Thanks. Have a great day.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Viatris, Genentech, and Vertex. It was produced by Jag and Detroit Podcasts. Follow our show on Apple Podcasts, Spotify, or wherever you're listening right now.